Good morning, friends. I am Dr. Rohini Kalan, Director of Alaknanda Diagnostic Lab and MD Microbiology. I'll be talking to you about coronavirus or COVID 19, which is the new name given to the disease, which is spreading all over China and to most of the countries all over the world also. I'll be just sharing few basic facts and I'll be making this video both in English and Hindi for the general awareness of public. First of all, what is a coronavirus? It's a known respiratory virus, large virus, and which causes respiratory disease or gastrointestinal disease. It was in December 2019, a cluster of pneumonia cases were found in the China, that is Wuhan area of China, and the cause was unknown, which was later on identified as the novel coronavirus and given the name novel coronavirus 2019 and later on as COVID 19, CO for corona, VI for viral, D for disease, and 2019 when it has been started or discovered. It causes, it was there were. It's a normally a coronavirus does not leads to fever, cold, and breathlessness, which are not very severe symptoms. But few of the severe diseases where the coronavirus has turned into a more lethal virus, like SARS, which was started in China in 2003, MERS, which was started in Saudi Arabia 2012, and this now COVID 19 that has started in 2019 in China. So, which are the group of peoples which are affected mainly can be, the family members or the healthcare workers who come in close contact with the people who are suffering from this, infected with this virus or suffering from the disease. How this has started, initially there is this thing that it spreads over from animals, that MERS and SARS, like MERS from camels and SARS from civet cats. That is, there is some mutation, genetic mutation is there in the virus, and there with because of the close contact of humans with the animals, this has spillovers into the humans, which leads to more severe kind of the disease. The exact mode of transmission is not known, but as with most of the respiratory virus, it usually occurs by when the infected patient coughs or sneezes. When the patient coughs or sneezes, it comes in the form of a droplet infection, which will go to some distance, then it will fall on different surfaces excuse me, and settle there, and it can survive for 3 to 5 days or in some cases up to 9 days on those surfaces. Okay, this is not an airborne infection, it's a droplet infection. Airborne infection, the virus can stay in the airborne for a long period and can be transmitted from by air from one place to other place. Here it is not transmitted by air from one place to the other place. It only travels for a short distance in air and then it falls on different surfaces and settles there. So the main, when you are preventing yourself, you are preventing yourself by, one is that contact with the person, and then is by the normal hygiene, by washing your hands repeatedly after touching these surfaces where you expect some of this virus must have fallen. Okay, so which are the group which is most at the risk? Most at the risk are those who come in close contact with the animals or live animals from where this virus must have come, or those who come in contact with the infected person, whether it's a family member or the one those who are taking care of the infected person, healthcare workers. What are the symptoms? Symptoms are usually as of other respiratory viruses, that is fever, cough, and breathlessness. It can turn into severe diseases, and usually this happens in those who are already suffering from some or the other kind of illness, and it can lead to pneumonia, kidney failure, or ultimately it can lead to death also. The mortality rate, exact mortality rate, is not known at the moment. We diagnosis is by taking the swab, the nasal and the throat swabs, and doing a PCR, that is polymerase chain reaction, in where we look for the genetic of the coronavirus. And the treatment, coming to the treatment, there is no specific treatment, only the supportive care, and for which, depending on what the symptom the patient is having. And at the moment there is no vaccine, and treatment and vaccine is in the process of development. So most important thing is the prevention. So prevention, most important. First of all, those who are infected, when or they suspect to be infected, so whenever they are coughing or sneezing, they must keep a tissue in front of their mouth and nose, or if tissue is not there, at least cover it with the back of their arm like this, so that the infection or the droplet does not spread too much in the area around. And those who come in contact, they should maintain a distance at least 1 to 2 meter, or 3 to 6 feet of distance from the infected person. And if they have to come in contact, either they are taking care of the patient, then they should be wearing the mask and wearing the other personal protective equipment like your goggles and your gloves while taking care of these patients. And very important that you have to be, hygiene has to be maintained. As I have told earlier, this virus spreads and falls on the surfaces. So every time if you touch any of these surfaces on which the virus has fallen, and you touch your mouth, nose or eyes with those hands, then there's a chance of you getting infected. So it's very important, if you are coming in contact with any person, then you need to wear the mask. Otherwise, if you yourself are infected, then you need to wear the mask, because mask alone is not going to protect you. Along with the mask, then hand washing, very important. Before you are touching any of your mouth, nose or eyes, you have to hand wash hands. Before eating, you have to wash hands. And whenever any other the infected person's utensils and other things have to be separated out, washed, and then only used. Coming to the spread from the animals, it is very important, whenever you come in contact with the animals, wash hands, try to avoid the unnecessary contacts. For eating, all the animal products which you eat must be very cooked very properly. So very important, when we talk about prevention, just wearing the mask is not going to prevent you. You have to be careful about your hand hygiene, because as I've told you, it will be there if some infected person has present there or has passed there, sneezed, coughed, excuse me, then it will be present on all the surfaces around, and it can stay alive for 3 to 5 days. So touching of the tables, doorknobs, railings, and then touching any of your surfaces like eyes, nose and mouth can lead to the spread of infection. So very important, that is hand hygiene, and your other, along with your other things like mask. Thank you very much. I'll be telling you, sharing more videos regarding how to wear the mask and how to wash your hands also in other videos. Thank you.